The floor is yours.
Good morning. Oh, no, good morning. Good afternoon. I don't know actually what time it is. Usually it's in the morning, but good afternoon to everybody. Thank you, Teodora, for the introduction. I'm speaking to you from Cluj-Napoca, Romania, middle of Transylvania. So for you not to be surprised about the organization that I'm representing, I'm going to start my slides as we speak. Please let me know if it's working properly.
Yes, we can see them.
You can see my slides. Thank you very much. So, name of the organization, as you see here as well, it's Fresh Blood. And when you are small, as we started 6 years ago, one of the main concerns you have that people should remember you. And we took the name Fresh Blood because the Hollywood takes the challenge of reminding the people that Transylvania is a place that has to deal with blood, and fresh blood is something that all the organizations need when they talk about innovation. I'm Ion Petrovai. I'm Director of Innovation of Fresh Blood Health Tech. We are also a EIT Health Hub for Romania. If you never heard about EIT Health, I encourage you to check out. I will talk a little bit later about this. And we are committed to help innovators change the world. That's the philosophy. When I got the invitation to speak at Biotech Atelier, it was a challenge for me to say, okay, what am I going to tell you? I mean, there are, especially before me, such a number of great speakers with a lot of expertise. And given the fact that pretty much half of my time is focused on helping startups, I tried to understand what would be relevant for people that either work with startups or work in a startup or even just care about healthcare innovation. And then I proposed this topic, Love the Problem, Solve, Validate, Iterate, Repeat, because our media and our context is usually pushing us to think about the idea. And everybody's talking about $1 million idea, $1 million potential business, but this actually comes from solving a problem. And I think that that's one of the key learnings or key maturity steps in the innovator pathway, to actually begin to care about the problem more than about his idea, and even more advanced to care more about the beneficiaries, potential beneficiaries of that innovation, which actually the people that have this problem. And my topic of today seems a little bit simpler, so quite obvious, but I wanted to get into a couple of details. And I will start with the story. The story is something that probably everybody in the healthcare field might have the impression they are part of this, about one man that stood under a cascade and saved the people that fell from the cascade into the water, and saved them, took them out. Some of them died. And at one day, after many savings, he decided to see why the people were falling into the water. And I think this is the aha moment when you begin to think a little bit in terms of situation and journey, and see beyond what are your actually tasks. I'm a doctor. I have a lot of friends doctors. I work now in between doctors and IT people. And I see in many situations, people just focus on what they have to do. And this is pretty much the perception of a job. You have a job, you have something to do, and it don't care too much about what is causing the thing and how this can be improved, let's say in a regular mindset. But once you are getting in innovation and you are focusing on understanding what you could do, you have a different perspective. And this perspective is now beginning to connect in different points to the reality, and maybe present many opportunities to actually be impacted. And I think that I don't know how many of you have heard about this concept of design thinking. It's a concept that has been introduced in the last decades in Silicon Valley, and I think it's at a large theoretical cause of what we see coming from the Silicon Valley in terms of solutions for the world. Because basically everything we use as improvement of our life is a solution to a problem. I was just thinking recently, booking a hotel or just booking a flight, it's using a tool that is saving you not only time, but increasing your confidence about what you are going to do in when you, for example, need to travel, or you need to you don't need to travel. You actually want to get to meet some people, and are the 5 steps. I'm getting a bit into details, but are the 5 steps that start with empathize. And I think I'm active in the field of healthcare, and we are focusing on healthcare innovation. This is why we got connected here. Empathizing is one of the key steps in connecting with the potential beneficiary. And empathize is very simple, it's Greek. Empathos is meaning having the same diseases as you. We could get another context, but actually if you want to become a solution builder, you need to, beyond empathize, you need to have compassion, meaning share the same passion. But that's probably the subject of another presentation in the future events. But everything should start with empathy, empathizing, and then from empathizing you need to define how the problem is looking to those that you care about. And then you come to the ideation, where actually you think of potential solutions, and then you're prototyping it. And prototyping is actually showing something that looks like a solution, but works like a solution, but is not yet a solution. And at the end, you begin to test it. And these are just a few steps, are taught in a number of books. You can find design thinking applied in many, many, many ways. However, they are very much connected with understanding how innovation can become relevant. And I'm just thinking the first word of my presentation would be to love. With empathize is actually disease, having the same disease. If you love a problem or you love a certain client, you will have a similar suffering, which is very similar to love. If love is shared, it's pretty much like a disease. Actually, there have been some studies communicating this. But then you need to go past across love towards understanding, and especially towards actually building something that is relevant. And medicine, especially in the last 50 years, got very structured and very procedural. And this led, of course, to some gaps through which some people are falling. And I like this quote, which are especially relevant for the people in the mental health care field, but not only, which says that it's far more important to know what person the disease has than what disease the person has. Which means that sometimes a disease that can kill you would be chronic in some people, and a disease that can be chronic would kill you in some people. And we see this all the time because you have so many determinants of health, and these all challenges create opportunities for innovation. And this has been repeated, and it's more and more repeated currently by the advanced, let's say, senior doctors that understand that therapy is a little bit more just giving a tablet or recommending a certain intervention. And actually, you need to understand what is the course of life of this person. And this is coming from a friend of mine, which is a practitioner in design thinking. And I like how he is proposing an expansion of the design thinking. Beyond empathize, you need to understand. And I think this is the first step of the what he's saying, the problem space. And in order to understand, especially in healthcare, you need somebody that can understand. This is why, for example, the Stanford Biodesign methodology that we apply at Fresh Blood and we work with the startups propose as the team member somebody from the specific field. So from my point of view, if you want to innovate in the field of mental health and you don't have a mental health care professional very close to the team that develops the solution, you're going to go very easy in very wrong directions. So you need people that can understand. Then you need people that care. And then you need people that actually can focus on something that matters. Then you will get to the solution and maybe have an idea that get prototype, test, and maybe, why not, sometimes even launching things. And I don't know how many of you have actually heard about the term patient journey, which means that the process where the patient and even the doctor is passing through the evolution of a healthcare problem. It's a patient journey, but you have customer journey, you have, I would say, educational journey. Everybody here has been through an educational journey, which is quite clear. You have standard school, then you have additional courses like or programs like Boy Scouts, like international competition, which are facultative, not mandatory. Let's say that the standard school would be mandatory in most countries, and then you have the self-study that you can also add to the journey. At the same time, the patient, which has, for example, here a first symptom and it's complaining about something, he will get first to maybe talk with a nurse, but actually more and more this is happening. The first interaction might be with the Google and with something that he finds on Google. Then he would reach a general practitioner. Then he would reach a nurse. And in this case, we are talking about oncology. And in oncology, we are talking sometimes several doctors that help the patient deal with a specific situation. And here you have, for example, oncologists, you have pathologists, you have the radiologists, and you have the treatment choices, which would come, for example, from a tumor board. And then you will have the intervention, therapy cycles, and then you will have the evolution of the disease, which can go to a survivorship and or it can go to a disease progression. And all these are different stages with different issues where actually you have opportunities to innovate. And I'm working with several startups that are focusing on this field. And I see countless opportunity to innovate and countless opportunity to collaborate with everybody here and with the patients, including the patient. Like, for example, you have a startup which is helping doctors and patients share their imaging examination, like CT, like MRI, like RXs. And this can impact significantly in terms of time and clarity a patient journey, even though if technologically is not so much advanced. It might not be necessarily an invention, a huge invention, but in terms of innovation can be highly, highly valuable. And we can have examples like another startup that I remember, which is focused on nutrition of the oncology patients, because therapy cycles need support. Getting into a therapy cycle on oncology is not something that has an easy path. But this creates opportunities to innovate. And then you're getting about the problem, because in this journey you will have courses and you will have situations, but this will go off course. And then at one point you need to focus on what is the problem that you're going to love or care about. And I like this. I'm a big fan of movies, and I like this quote, which is actually a quote from a psychologist, not just a quote from Jack Sparrow and from the scenarist that wrote this. The problem is not the problem. The problem is your attitude about the problem. Do you understand? And it's funny because sometimes we just go past some really interesting insights, and these insights are potentially useful, but we are not. If we don't get them from the right point, we might just ignore it. And in this context, one of the challenges of innovation is that you need to understand who has the problem and how the problem looks to them. And I'm just using this chart from European Connected Healthcare Alliance, where we are also a member, which is putting all the stakeholders of the healthcare, I'm not talking here just healthcare innovation, but healthcare in general, in a context and saying, look, who has the problem? And we will just talk about an oncology patient. The fact that the patient is late diagnosed, it can be an impact on the providers. It can be an impact, of course, on the patient, but it can be an impact, for example, on certain labs, or it can be an impact on governments, which would need to pay additional money. And you need to understand what is the problem and how the problem looks to them. Because governments, of course, would like to spend less money and have more happy people, because it's, after all, it's a political management. Professionals would like to treat patients that have higher degree of success or professional satisfaction. Of course, patients want to suffer the least and to pay the least, which is also a part of suffering. And you need to align this problem understanding when you are going to pick up your fights. And many people focus too little on the problem space and focus too little on solution space, because they are very comfortable to start with the idea. And yeah, I have a great idea. And whenever I'm talking with a startup, I have to push back and say, look, what is the problem that you are trying to solve and for whom? And do you love the problem or the people that have the problem? And this is, for example, highly relevant if innovation is coming from somebody that has a personal impact. Like, for example, the IT guy that has a mother that suffered from appointment or from misappointment, and he said, I'm going to fix this problem. I will make sure that my mother and the, other people's mother will no longer have to wait for an appointment that will make them suffer uselessly. And one important thing also, and it's hard to accept in the healthcare field, but you need to consider this, because the easiest solution to any problem that you encounter in the field of healthcare is to ignore the problem, because there is not enough money, there is not enough time, there is not enough know-how to actually solve all the problems that there are, and people will prioritize. And they will prioritize in terms of their own priorities and not necessarily in terms of who is making a hardest impact, who is driving more suffering, because there are always financial consequences, there are always challenging choices to make. And sometimes it's the easy way is to ignore the problem. I'm not saying that you should, but there are plenty of examples where the problem is ignored. Like, for example, in Romania, the national healthcare system has a software which is not functioning. And this is happening for 10 years now. And everybody's complaining, but the easier choice is to ignore the problem from a number of reasons. I'm not going to detail now about this. However, until I'm used to say that the problem it's ignored until either enough people or the right people get to suffer. It's a little bit cynical, but we are among professionals here and we need to understand this as a perspective. Okay, now, how are you going to move forward if you think, okay, you have a problem that some people care about it? You are going to talk with the people that you think that have the problem. However, it's very important how you talk with these people and what you ask them and how do you analyze their answers. And I cannot recommend enough this book, which is called The Mom Test. And it's a very easy read. You can find it online, as well examples, summaries. It's about understanding the reality. And we believe that, especially in healthcare, which is highly emotional, because startups with a healthcare component get a lot of visibility, that get a lot of interest. However, when they meet the reality, they get sometimes very much killed by the reality in brackets. So highly recommendation to read the Mom Test in order to actually get a proper understanding of the problem and the proper evaluation of the solution that you are trying to build. One thing that you should not forget, solutions are for clients, are not for are not for just yourself if you're an innovator. And I'm just giving you an example. This is the Romanian healthcare startups map. We are making this every year. This is already obsolete because it's January 2022. Some of startups already disappeared. Some of the startups grew. Some of the startups appeared, but we will do an update in January 2023. Part of the activities at Fresh Blood and Activize. And we splitted this not through technology. Most of the startups are divided by technology or by use case. We splitted this based on the client. And the client is either concerned individual on the left up, either the patients and families on the right up, or institutions that might be healthcare or not, some of them, healthcare professionals, and we put on the bottom telemedicine because this was starting in the pandemic. Everybody was started to think about telemedicine, and telemedicine, incidental or not, is still relevant for most of the people here. So telemedicine is just the ground. We used to say that telemedicine is the low-hanging fruits that is going into the healthcare innovation. We are trying to help, and we are part of this program, which is called EIT Health, which is co-funded by the European Union. And in this program, we can find, for example, now it's end of the year, but this will very soon pass. And in January, you will be able to find these kind of programs for entrepreneurs and innovators, healthcare professionals, investors, patients and citizens, startups and SME, or students. You can find on the eithealth.eu site these opportunities that I encourage you to use. And also for Romania for the moment, but we are planning to expand this internationally, we built something called Hub Vantage, which is a hub for reality checking, because we saw that people have a very limited understanding, especially healthcare startup founders have a limited understanding about how the healthcare system works and have a hard time getting connected. And we have this program, which is now running in 2022. We plan to continue this on 2023 to put together healthcare startup founders and healthcare mentors to provide them with opportunities to grow. This is done with the EIT Health funding together with Hive and with Activize. Hive is the Babeș-Bolyai University Center for Healthcare Innovation, and Activize is one of the ecosystem information managers in Romania. So I'm getting close to the end of my presentation. A few recommendations for the innovators. You should focus a lot of time to understanding the problem. Also, if I may add, why has it not been already solved? And I have seen this situation when people go and say, look, but this is not good. Or this should not be like this. This is not acceptable. Great, that's not acceptable. That's a very political description. Not acceptable, but still happening means that actually you are not accepting that, but if you don't do anything to change it, you are actually accepting that, which is counterintuitive, but this is happening. Another recommendation, validate, 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 meaning that you need to understand the reality. You need to talk with the right people, meaning stakeholders and people that have the problem. You need to talk with the potential clients that are going to pay for your solution, and you need to understand whether this is scalable. And validation is a process that never ends. And another recommendation, you should be flexible, because this is a process that is constantly moving from one step to another. And I've just come back with this slide. Here, for example, sometimes you empathize, you define, you have an idea, and then you realize that maybe your solution is not optimal. And you have to come back to understand why the solution is not optimal, to empathize with the people that maybe want to build your solution, and in this context, maybe get to a new problem that you are aiming solve. So if you are curious, there are two focus groups, one healthinnovator.eu on Facebook and LinkedIn. It's curated by Fresh Blood. You can reach out to me at igpetrovai@freshblood.ro or LinkedIn or Facebook. I don't know Instagram. TikTok, it's still on the I'm learning curve. However, just if you want to reach me, you can find me, and I will be more than happy to take a couple of questions for the end of my presentation. I still have another 4 or 5 minutes or so.
Perfect. Thank you so much, Ion. That was really great. I really liked your recommendation for this book. I myself have read it, and I am constantly implementing it in my day-to-day life. It's really great. There is one question from the public here about the accelerator program. Is it open globally, and what exactly does that offer?
I'm talking about accelerator of EIT health program.
Yes, correct. Yeah.
It's open globally, but of course there are some specifics to each of the programs that are inside the accelerator. So if you check there, you will see what is, for example, dedicated for Eastern Europe or for Southern Europe, so-called RIS region. Some program is for the whole Europe, or there are some conditions that are let's say more favorable to Eastern Europe. Keep in mind that EIT Health means European money, which means that they have to impact Europe and they have to help European innovators to grow on this. So you need to check on a program by program. You have programs which are very interesting. For example, Bridgehead. I didn't touch it, but we have startups from Romania that are now in Bridgehead, where you, for example, if you are a startup from Eastern Europe, you can get support to expand to another major market, like, for example, Germany, like, for example, with the States, like, for example, from Israel. And I have a startup that got to China through Bridgehead. So at this, in this context, is basically an international impact program, but you need to see what fits your situation.
Understandable, yes. And also, I think we have time for one more question here that I find quite interesting. It says, should the patient, in such case for digital healthcare solutions, be actively involved in solving the problems?
Well, I do believe that my personal contribution, but I don't have enough arguments, is the patient should not be part of not be the focus of the situation, but the patient should be part of the solution. They are basically sometimes the part of the how the problem is showing and how the solution is implemented. I like the quote from NHS, which says, "Nothing about me without me," or like if you prefer the American way, American motto, no taxation without representation. So I do believe that the patient could be, however, it depends on the problem and it depends on the patient commitment. And I see, as a relative of patients, I have, of course, as a doctor, I don't have so many doctors in the family. Everybody is coming to me when they have a healthcare problem. And not everybody is available / prepared to contribute. Sometimes they can damage the situation, and this needs to be managed. I do believe that patient can influence significantly, but this needs to be, I would say, aligned with the others, because otherwise, if you just focus on the patient needs, on only the patient needs, you begin to lose potential benefits from a medical point of view. And sometimes it takes a lot of time to explain. Sometimes it takes information that needs to be passed through, and you need to make sure that people are able to provide an informed consent. I would say that a chronic patient usually knows more about his disease than his doctor, especially if it's an educated person. However, the decisions still need to be shared. I mean, the doctor is the one that will, at the end, assume the responsibility of the disease. And I have seen situations where the patient, decided in a different way, and it was not the best decision over the long term. It needs to be aligned, and we are not prepared for this, unfortunately. But we should strive for this. That would be my comment, a little bit extended.
Yes, I agree, especially here in Bulgaria. I guess it's the same in Romania. Health literacy is not that great, which is another problem. Maybe the solution to that is what we discussed in day 2, which is patient advocacy and specific people, patient advocates that are first of all trained, educated, have both perspectives of the medical field and the patient in line, and that way maybe we will find a better solution rather than just putting another weight on the patient.
Yeah, it's once you should avoid the blame game. It's very easy to start who is guilty of that outcome, while actually the focus should be what can be done better in that situation.
Perfect. Thank you so much for your contribution and for your great presentation. I really enjoyed it. And we will share the recording later on in the next following days. Thank you, and I hope to see you again next year.
Thank you for the invitation. Looking forward to see more people innovating in healthcare, and if I can help, happy to answer any reaching out.
Absolutely. There is also a Bitmatch platform dedicated to Biotech Atelier. So if anyone wants to register and just...
I'm there as well. You can reach out
Perfect.
to me there as well.
Yes, exactly.